So I frequently get asked what you should do when you're pregnant or postpartum for your pelvic floor, but I think that there is a lot to know about your pelvis even before you get pregnant, like how old injuries or imbalances can play a role in pain during pregnancy and labor. And trust me, it is so much easier to address them before you get pregnant and will help to improve your experience throughout. With this video, I'm going to address more of the mobility concerns, and then with future videos, I will get more into how old injury, muscle imbalances, and strengthening kind of play into that picture as well. So some of the biggest complaints during pregnancy are hip pain, low back pain, pubic symphysis dysfunction, incontinence, and round ligament pain. So let's kind of break those down a little bit here. So one of the first things I want to talk about is hypermobility or double jointedness, and this can play a role in hip pain, low back pain, pubic symphysis dysfunction, incontinence, and round ligament pain. So there's some quick tests that we're going to run through to see if you're a little bit more on the hypermobility index, and this will mean that you have some different things to watch out for through pregnancy. So we're going to run through the Bite and Hypermobility Index next. This is just kind of a quick general screen. We're looking for more than 6 out of 9 points on the scale. Each point is assessing a joint or movement. So the first one is kind of passive extension of the pinky. You want to see that get up beyond 90, and you're going to assess that on both sides. Then the next assessment is if the thumb is able to touch the forearm in wrist flexion, again assessing both sides. Extension of the elbow beyond 10 degrees on each side, and extension of the knee beyond 10 degrees on each side. The last one is being able to palm the floor, so that bending forward and place your hands on the floor, keeping your knees fully extended. So if you're hypermobile, what do you need to know? The strength of our core and pelvic stabilizers is going to be huge for managing any amount of pelvis or round ligament pain during your pregnancy. But it also means that you may be more likely to over recruit through your pelvic floor and maintain a little bit more tone, especially if you're an active individual. You may over recruit with your pelvic floor and grip with these muscles even more if you've also added the suck it in habit to your body. Just because you may grip through these muscles doesn't necessarily mean you'll experience any pain with sex or exams. But we need a lot of mobility here if your goal is to have a vaginal delivery, and we don't like to address this when you are pregnant. So let's go over some of the tools that I use to help people be more aware of your pelvic floor and your pelvic floor tone. Number one is going to be the internal exam. Again, this is always performed with patient consent and comfort. If you want to be done, we're done. I'll always give my patients kind of a roadmap as we do this so that you can start to build a little bit more of that brain muscle connection and some awareness of what these muscles are, because most of the time we don't know these exist. While we're going through this exam, I'll have people perform a contract and relax while bringing attention to any specific muscles that are having a harder time lengthening and relaxing. I may spend some time mobilizing any scar tissue or addressing any tailbone mobility. Just kind of depends on what we find. Okay, so the second tool that I will use a little bit more of is biofeedback. So if you think of those heart monitors, we're going to place similar kind of electrodes externally on the skin of the perineum. These are close to midline so that you can see that they are on kind of these pelvic floor muscles externally and not on the bigger glutes as this covers this region. This is going to give better real-time feedback of how many microvolts are being output by these muscles. And I'll like to have people go through varying phases of relaxation, quick contractions, and endurance holds in different positions so that you can get more real-time feedback of how much tone those muscles are maintaining. And you'll see this line fluctuate based on the strength of contraction or how much of that grip is occurring as well. The third tool is every PT's favorite thing, consistency. So if you do something multiple times a day, it is unlikely that you're thinking through kind of every bit of movement every time you do that task. So if you can improve your awareness of gripping frequently and consistently, the faster you won't have to think about it. I will initially have people check in kind of like every 30 minutes to an hour, if possible, which I know sounds like a lot, but again, the faster you build that brain-body connection, the faster that you don't have that tendency. Posture and sitting setup will also play a role in this, but that's going to be a whole separate video at some point. So to wrap up this section, I love that the internet is a wealth of information, but I want to make something very clear within my videos. You can be a super self-aware person, but there will be things that you miss. We all do, myself included. The reason a lot of tools you can find on the internet may or may not work for you is they're not specific to you, or they don't address the whole picture. And this can be super frustrating for people. So finding a practitioner that is going to take the time to review your entire history and that entire picture, that holistic picture, with you and problem solve through them is huge. A pelvic floor assessment does provide a lot of information on things like muscle tension, nerve tension or hypersensitivity, any amount of scar tissue, decreased tailbone or pelvis mobility. The list kind of goes on and on. So while an internal assessment is not for everyone, and it's always up to you and your body and how you feel in that moment, this does provide a lot of information for your PT. So much. The more information collected, the more specific and effective your plan is going to be because it's tailored to you and your specific kind of imbalances. So thank you for watching, and let me know if you have any questions or certain topics that you would like to know more about. Have a great day.